When working with children, it is important to promote an environment of trust and fun. Children can be unpredictable, uncooperative, or challenging to communicate with at times. You may need to adjust your language or behavior depending on the age of the pediatric patient. Encourage the child to participate in the evaluation. For example, allowing the child to turn the WalkAide on and off or to push the stimulation button themselves can help them to feel more comfortable and in control. It is essential to identify a multidisciplinary team to support the child. Develop a WalkAide rehab plan of care with the input of patient, caregivers, and physical therapists. Considerations including the age of the child's goals, the family's goals, the care pathway, rehab or ADL, and the child's current clinical presentation. Other factors that may affect the rehab plan of care include family involvement, cooperation of the child, previous treatments, surgical interventions, spasticity management, orthotic management, seizure history, and prior exposure to electrical stimulation during therapy. Depending on the evaluation findings, a WalkAide hybrid system may promote the optimal functional outcomes for the child. Complete the WalkAide system setup prior to patient arrival. The 1 1/4 inch premium blue gel electrodes are recommended for pediatric patients. To test the peroneal nerve response, apply the electrodes. Do not use the mini stim, which could deter the child from participating in the evaluation. Moisten the electrodes with water. Place the back electrode near the fibular head and the front electrode on the upper third of the tibialis anterior muscle belly. Turn the WalkAide on by turning the blue intensity knob in a clockwise direction. An audible beep will sound and a green light will flash intermittently to indicate that the unit is on. Start with the intensity set to 1 and slowly increase as tolerated to produce the appropriate foot lift. While testing the electrode placement, mimic the cuff with your hand. Maintain total contact over the electrodes with one hand. Utilize the manual stimulation button, which the child can push, or use the exercise mode. Observe the foot movement. When possible, have the child mirror ankle dorsiflexion with the sound side. Retest the electrode placement by pushing the stim button or having the child do it to assure the optimal functional foot lift. If the response is lacking, make sure the cuff fits snugly. Readjust the cuff or reposition the electrodes as needed. Retest after each change to assure the appropriate response. Adjust electrode location to achieve functional foot lift as necessary. If the amount of eversion or dorsiflexion is less than desired but is present, it is okay at this point to introduce walking with the device using the manual stimulation mode. Getting the child up and walking distracts them from any fears they may have. At this point, the patient is ready for data collection and programming. Here are some recommendations for electrode placement. Always use the lowest intensity possible to get the desired response. This will enhance comfort by managing the net charge. A strong or odd sensation is okay. Pain, stinging, stabbing, etc. are not. Make sure that the skin is clean and that the electrodes are wet. This affects comfort and function. Always begin by identifying the starting point for the black electrode. Adjust the spacing between the black and red electrodes or their positioning to achieve the desired foot lift. Evaluate functional foot movement during sitting and standing before asking the person to walk, assuring a safe and effective foot lift for walking.